with a little extract from my book. This is an experience that takes me back to 1985, and as my children used to say to me, what was it like when the dinosaurs were around? So I'm going to read you an extract and then just have a little chat, and then we'll go on to the panel members. I started reading research on psychiatric patients. It turned out that their experiences were as underrated in mental health research as they were in mental health services. Now this was just as I had kind of got myself out of the mental health system and was starting to think about setting up a peer-led organisation. All the research was done by well-meaning professionals and academics who saw us as vulnerable people who could not determine our own best interests. Mad people did not have needs like everyone else, but felt needs, implying that professionals were the final arbiters of what our actual needs were. One report I read was about people I'd been in hospital with in Dunedin. Do you know where that is? Yes. Oh, it's cold down there. In 1983. I don't recall being interviewed for it. It was done by social workers who designed the research, selected the patients, interviewed them, interpreted their comments, made the recommendations, and wrote up the results. The people I had sat in hospital with seemed to die on the page. People like Richard, pacing in his dressing gown, Jill, sobbing in the dark, Maria, who bit herself until she bled, Brooke, who helped me laugh at my despair. The report's portrayal of them reminded me of dead butterflies behind glass, arranged in tidy rows with their wings pinned down. Now, it's 30 years since I had that experience, and a lot has happened since then. And we have what has been described here as the green shoots of user-led research. And we all know what's going on in 2015, but I want to project ahead another 30 years. And I want us to start thinking big about where we could be in the future. Because I think we sort of scrabble around in the present and get quite sort of comfortable and satisfied with where we're at. See, by 2045, imagine if we had departments of peer support and or MAD studies in all major universities, with professors who have lived experience, and chairs of departments who have lived experience. Imagine if we had MAD studies and peer support journals, multi-million-dollar research grants, well-recognised and respected peer or MAD methodologies, and a strong evidence base for the approaches that are important to us. Imagine if we had peer-led and co-produced courses and all professional training, not just for peer support workers, but for general, the other professions. If we had educational research opportunities for people with lived experience in all tertiary institutions, careers in mental health and addiction that openly honour lived experience. And I don't think we can be satisfied with where we're at today. And I think we need to be bold, audacious, think big and think future. And I hope that this panel discussion opens up a discussion about where we might be going. So thank you. Now what I want to do is pass it on to the first panel member, who is Sione, and Sione is going to speak for 3 minutes or less.
Thank you. Thanks, Mary. Thank you, Mary. So my name's Sione, and I'm the manager of CARMA, which is a drug user organisation in the ACT. So we're a bit like NUAA, but in the ACT. So I guess my expertise, such as it is around people who use drugs, including myself. So we're a peer-based organisation, and part of our role is to stand up and talk about our experience of drug use. I wrote a few notes for this, and they ended up being pages and pages, so I've just taken a couple of points out of that to quickly open up what I want to say. And I thought I'd just approach, I'll talk about barrier, and I'll talk about quickly about an enabler that I see, and a little bit of hope that I have as well. which unfortunately is, unfortunately the balance unfortunately is in the barriers part of my talk, of my few comments, but I just thought that I'd bring to the table something specific around drug use. I think that we were talking in the break with a few people about what I see as almost a fairly artificial joining of mental health and drug and alcohol in bureaucracy. I was saying that I see the crossover as being a bit like one of those Venn diagrams you see at school. There's absolutely crossover between people who have mental health issues and people who have drug and alcohol issues. There's a huge number of people in either camp who don't have those issues, but we're continually, through the bureaucracy anyway, dealt with together. That's a barrier in itself. But I'd be remiss if I didn't talk about the criminalisation of illicit drug use in particular. I can't speak to alcohol. That's not my experience or my knowledge. But I know for a fact that the criminalisation of drug use is one of the key drivers for the stigma and discrimination that exists around illicit drug use. And that stigma and discrimination is, as Mary has already spoken about this morning a little bit, and as I think we all know, is one of the key reasons why there are still very few consumer-led researchers involved in drug and alcohol, and certainly people who are able to be open and honest about that. I know a number, at least 6 or 7 off the top of my head, of people who are current drug users who are also academics and research in that field, but simply don't talk about it openly for a whole range of good reasons. So just to go back to the way that drug and alcohol and mental health are, so criminalisation is a key one, which is pretty obvious, but I think it needs to be put on the table. But I also think something that maybe is a little more controversial, at least outside of drug using circles, is in my opinion, the over-medicalisation and pathologisation of drug use. So essentially, all dependence now is pretty much seen as an illness, and we are sort of treated as though all drug use is a problem, when in fact what there is a continuum of drug use for most people. So you might go through a period of dependence that's quite hard to manage, but then there equally might be periods in your life where it's perfectly fine to manage your drug use, and the main problem you have is the fact that it's illegal. But nevertheless you have to engage in a treatment sector that persists, and not through individuals, but again I'm talking about structural stuff, persists in seeing us as ill or diseased. And that in itself is, and I think there's some absolute corollaries there with mental health issues as well. Certainly, maybe still today, but certainly could be a bit worse in the past. But we're still living through it strongly with drug and alcohol. To be a little bit, so I've got a whole bunch of other stuff I could talk about there, but hopefully you guys will speak as well. I do think though that as far as pathways goes, we're very lucky in Australia to have drug user organisations like NUAA, Karma, ABLE, which is the national group. There's one in nearly every state, and as Mary pointed out, they're all around the world. And what that gives us as people who are highly criminalised and marginalised is a little bit of cover and a little bit of organisational power, I suppose. It's very tiny, it's not much, and the organisations themselves are discriminated as well. But what it does give us is the opportunity to come up and speak at platforms, speak in situations like this, and know that we are backed by an organisation that will look after our needs and understand us as people, not just as people with a drug problem. I debated whether or not to mention this, but I just have to, because of what we were talking about today. In this, I've been a little bit preoccupied because, and Mary has too, I think, because today we've got a classic example where a very large research organisation has sent us a bunch of questions about stigma and discrimination that they want to put into some research that they do with our community, and they've given us 3 days to feed back on the questions that they've already produced. And I think I hope I don't really even have to go into how insulting and problematic that is. Both Mary and myself are at this all day. I'm away at a conference from Saturday through the entirety of next week. And even if I wasn't at those things, that's still simply not enough time, 3 days. So that is another structural problem. But nevertheless, we have the backing of organisations to actually put our foot down and say, no, if you want us to help you in the future, because we do a lot of the recruitment for their research and whatnot, then you need to treat us with a bit more respect. So finally, on the hope side of things, generally speaking, I have anyway, in my experience, had pretty good open discussions and understandings with a lot of researchers. They may not be consumer researchers, but they're more and more at least collaborating with us. And as I said, I can name at least 6 or 7 who are consumers who are more and more able to open up, at least in closed environments in some conferences. The INSU conference, which was a hepatitis conference last week, was a couple of weeks ago, was a great example where there was a consumer on every single plenary and in every session. And finally, I think prohibition can end, and maybe it will happen faster than we think. That's my last hope.
Straight in? Straight in? Okay. Hi everyone. So I am sitting here as someone without lived experience of either drug and alcohol use or mental illness, so a bit of a fraud maybe, but maybe that's where we're moving forward, is looking at partnerships and finding those allies and supports where they are. So I'm very happy to be here, and I don't want to follow on from either of you two, but I'm going to simply say I think we've heard from today that in fact today already there are lots of little silos of quite exciting initiatives happening and things that we don't have a collective knowledge of, but they're existing, and there are some really exciting single initiatives happening all over the place. So my dream for tomorrow, I'm going not quite as many years ahead as Mary has gone, although hers were way more exciting and much more inspiring. But here's my less visionary, maybe first step thoughts. I think it's time for us to look at shared and collective action. We're seeing these silos of action. It's time, and what a fantastic forum this is to kick off, and the network to kick off this really collaborative shared action moving forwards. I think some of the things we should be looking at is really profiling the work that already exists. Did everybody know the stuff that Cath Roper, etc., that other people are already doing? We need to know about those things and be able to share those things. I think the network is a perfect body to really be joined by others to really influence research agendas and really push and highlight what consumer priorities for others, even if it's not consumers doing that research. Change the agenda of research anyway. To influence access and opportunities for consumers to take a leading role in research, and I think that involves a lot of brainstorming, I think, from all of us, is really how can we actively influence enhancing opportunities for researchers. Some thoughts that I've heard today is why aren't we insisting that government services as well as non-government services quarantine some of their funding and their money that's around evaluation and research? Why isn't some of that being quarantined, a percentage and a commitment to quarantine a percentage for consumer-led research? That should be something that should be happening, and it should be something we could call for. I think there's a lot of talk and people don't walk the walk, so holding those research funders that do talk the talk and organisations that talk the talk, hold them to account and get them to actually walk the walk. And perhaps being a little bit positive, taking a positive approach to that is to celebrate those who in fact do walk the walk. And make a public celebration of the good initiatives and where people are actually walking the walk, rather than grizzling about the non-walkers, really starting to shame those non-doers by highlighting the doers maybe. So that's me. Thanks.
Thank you. And Jules.
Hi, my name is Jules Kim. I'm the Migration Project Manager from Scald Alliance and with the Australian Sex Workers Association. What I'm going to use is the example of our research that we did, which was a peer-based research with migrant sex workers, and it was the largest research of migrant sex workers in Australia to date. And had peer, not only was it peer involvement, but it was peer-led, peer-driven at every level and every stage, like from the inception to the collection to the analysis. And that was very important. And I guess the reasons why we did that, took that approach to have a peer-based approach, was because of the barriers, which I'll talk a bit about. And I'll talk about how the peer approach was the enablers to make a very successful research project. And like all good research projects, there was a whole range of unintended benefits that come that are beneficial for the community if that you are actually taking a peer-driven approach. So. At the time, there was a huge gap in research of migrant sex workers, and there was a lot of speculation about the nature of trafficking in the sex industry. So there was no reliable evidence, but there was a lot of speculation, a lot of, media interest about trafficking. There was data from other countries, but as you know, Australia geographically is very different. So we have. We're very different, for example, to Europe, where the borders are it's like travelling between Queensland and New South Wales, going between countries. So it's a very different paradigm in Australia, but yet we didn't have the data. So we were funded by the Australian Institute of Criminology to do a research project. At that time, a lot of people had attempted to do research with migrant sex workers, but they kept coming up with migrant sex workers don't want to talk, they don't want to talk to us, or they're not interested, or they're not engaged, or they just want to work and they don't want to talk to you. They're not interested in their rights, and so whatever reason for why they couldn't access migrant sex workers. There was a range of research that was kind of promoted where the researchers had gone into detention centres and spoken to migrant sex workers in detention, and then extrapolated on all migrant sex workers from the small number of migrant sex workers they spoke to in detention. And not only did they do that, they actually counted, double, triple, quadruple counted. So they asked each person in detention, how many people do you know who have been trafficked? And so they said, I know 5 people. And then they asked the next person, they said, I know 5 people. And then they added that, so that's 10. And then the next person says, oh, I know 5 people too. So by the end of it, those 5 people were counted as, no joke, 1,000 people. So it is highly problematic when this flawed methodology and I suppose negative perceptions about sex work and migration. And I think, mental health is an issue that has a lot of the, is something that will have a lot of the similar issues of negative perceptions about, understandings that people have, or expectations or stereotypes. And so what we did was and of course for migrant sex workers too, at that time there was a lot of raids, there was a lot of visa checking, a lot of scrutiny, a lot of reasons why people didn't want to engage with outsiders. Completely understandable. Somebody turns up at the door, people don't want to talk to you. Who are you? Why? What are you doing? So actually having peers that were networked in to those communities actually solved a lot of those issues. So there was that trust there from the outset, which was really important. There was also, issues of informed consent. When you're actually kind of asking for consent from somebody who's speaking a different language, how can you say that you've actually obtained informed consent? So that was really important, having peers that were from the same language backgrounds, that spoke the same language as the people that were being researched. Anyway, look, there's I've written quite a few papers on this, so if anyone's interested, you can Google my name. I'm aware that I've probably run out of my 3 minutes, but it's really important, I guess. What happened was we were funded to speak to 100 people. About 6 months in, we'd spoken to 500. So the funder then decided to increase, to keep it going for another 6 months and give us more money to continue and to take in a few other states and territories. So it became a national survey. In the end, we had 1,000 sessions of community education, and that's the important bit. There was no pressure for anyone to do the survey. There was no withholding of services for not doing the survey. There was no pressure for anyone to actually, you know, and that was really important. And another thing that was really important for people wanting to engage was the fact that this would actually have a benefit to them. You know, this was like, that was the main initiative for people to actually be involved when we said, you know, this is to improve understanding and services for migrant sex workers. And people were really excited to be involved in that, you know, and they said, look, we've been researched a lot at work, but we never get told what it's for, how it's going to be used, and we never get access to the results. You know, so that was another major problem for people, you know, wanting to engage in research. So importantly, we had over 1,000 instances of community education around Australia. We connected sex worker organisations to migrant sex workers. We created a valuable pool of peer educators, you know, bilingual peer educators, via the training that was given through the research. And on top of all that, we had an incredibly successful research project, which with 679 surveys considered valid for analysis. And this is the largest survey of migrant sex workers in Australia to date, and will inform, you know, service delivery and policy for years to come.
Hi. Everybody's made a lot of great points. I volunteered my time to Jules, so I think that was an incredibly inspiring story, and you know, I didn't know all those details, and I'm pretty blown away by them. You know, in terms of barriers, I'm not going to talk too much about that. But one of the barriers that we as an organisation face is time and resources. And I think that's a barrier on the side of the researchers as well.
I have to say, I wish the consumers that I research with now might get up and agree and own this, but we all realised we all had stigma, and the stigma was that I thought the barrier to engaging consumers in research was actually the capacity of the consumers to do research. Well, it was crap. It was about the opportunity. So when we advertised with a good salary for consumer researchers, you wouldn't believe the talent that applied. So many people with long-term serious mental illnesses, yeah.
I think at the end of the day, we're all seeking self-determination, ability to, you know, a recognition of our agency. We want respect, we want dignity, you know. Really, our issues are not that different, you know, and I think a lot of it comes down to negative perceptions and misconceptions held by society, which is why research is so important, and which is why peer-led research is so important in breaking those stereotypes.
I'm quite interested in the work the stuff that we do with each other as peers, and how we support each other, and how stigmatised that work is. When you kind of like move into the space of when you support somebody else. In my situation last year, I supported someone with psychosis as a peer, as a very informal kind of arrangement where we kind of gathered a peer group and actually got somebody away from a potential kind of admission, which probably would have been a long admission, through our own actions. And the telling of that is transgressive. It could even be transgressive in this space, but I think we absolutely need to find a space where we can tell those stories around what we do with each other and how that is regarded.
I think that really resonates to the work that peer drug user organisations do, and to an extent some of the constraints that have been put on us over time. Certainly when we started, a lot of our funding, and still is for some of us, is based around bloodborne virus harm reduction, and the key was always about keeping people as safe as possible.